Hello and welcome back. Now we're going to be discussing hypoglycemia or low blood sugars. Please refer to your diabetes binder or Pink Panther book for more information about hypoglycemia. A blood sugar of 65 milligrams per deciliter or less than 80 with symptoms is considered hypoglycemia. Low blood sugars can be caused by too much insulin, skipping or not finishing meals or snacks, or increased activity or exercise. Low blood sugars can feel different to different people. Let's discuss some of the symptoms of hypoglycemia. Symptoms of a mild low blood sugar may include feeling hungry, shaky, dizzy, anxious, having blurry vision or headaches, feeling tired and weak. Symptoms of a moderate low blood sugar include inappropriate behavior. Your child may be crabby, confused, or not acting like themselves. Altered consciousness. Your child may be sleepy or difficult to wake up. Fast heartbeat, inappropriate sweating, pale cold skin, muscle cramping, or nervousness. Symptoms of a severe low blood sugar are unconsciousness, seizures, or the person may be combative, unable, or unwilling to swallow. It is important to recognize the symptoms of your child's low blood sugar as they may vary. Some children do not feel their low blood sugars, and oftentimes, parents recognize their child's low blood sugar symptoms before they do. Now, nurse practitioner Dr. Pamela Jennings will discuss hypoglycemia and its treatments.
If your child has any symptoms and if they're not sure if their blood sugar is low, test their blood sugar with a glucose meter. If you're unable to, for any reason, test their blood sugar, treat their symptoms like a low blood sugar and test their blood sugar with a glucometer as soon as possible. One way to prevent hypoglycemia is to give your child the insulin as prescribed. You may need to adjust the insulin dose or food amount for activity. We encourage blood sugar testing 6 times a day and any time your child feels different. Teach your child to tell an adult and use the words, "I feel low." Your child should tell, test, and treat whether they're at home, at school, or with friends. This is how to manage a low blood sugar. Always carry juice, glucose tabs, or glucose gel. Have the meter, test strips, and lancets to check the blood sugar. Always wear a diabetes identification, such as a necklace or bracelet. Tell your family and friends that you have diabetes and tell them how to treat a low blood sugar. Send your child's blood sugar log to the clinic by email. Having a low blood sugar can be scary for children and their families. The tendency is to overtreat and go from low to quite high. We strongly encourage you to use the rule of 15 in treating lows to bring the blood sugar back in range. This is the rule of 15 for treatment of low blood sugars. Treat low blood sugars under 65 or blood sugars under 80 with symptoms. Treat low blood sugars with 15 grams of rapid-acting carbohydrates. Then retest in 15 minutes. If the blood sugar is still under 80, give an additional 15 grams. Try not to overtreat lows. Children may still feel shaky in 15 minutes, but blood sugar should be over 80. If low blood sugar is just before a scheduled meal or snack, you will not give insulin for the simple carbohydrate, but you will give insulin to cover the carbohydrates in your meal. Some examples of 15-gram simple carbohydrate snacks include 4 ounces or a half a cup of juice, 4 glucose tabs, or 1 tube of glucose gel. Every child is different, but we have listed guidelines for helping determine, based on the type of activity and the length of activity, how many carbohydrates your child will need to prevent low blood sugars. Please refer to the chart in your Managing Childhood Diabetes binder. Always have extra snacks in a bag near your child when they're active. This can be left on the bench or with your child's coach. Please refer to your diabetes binder and Pink Panther book for tips on snacking during activity to prevent low blood sugars. Now, another nurse practitioner from our endocrine clinic, Dr. Donna Marvickson, will talk to you about using Glucagon for severe low blood sugars.
Every person who uses insulin must have glucagon with them at all times. Glucagon is an emergency hormone that is given to raise the blood sugar. You would only use it if your child was unconscious or unable to swallow. I know this is scary, but know that most people have diabetes and take insulin their whole life and never need to use these products. It's very simple to use. You either take it as an injection or a spray up the nose, and you only use it if your child is unconscious or unable to swallow. Remove cap from the syringe. Hold the syringe like a dart and insert into the stopper. Keep your fingers away from the plunger. Inject water into powdered glucagon. Gently shake until the powder and water become a clear solution. Using syringe, withdraw the solution. Children weighing less than 50 pounds withdraw and give only 1/2 of the solution. Find the most easily accessible injection site in your thigh muscle. Keeping your fingers away from the plunger, insert the needle straight into the area as you do when giving insulin. Do not slant the needle. Inject all of the solution. Withdraw the needle and apply light pressure to the injection site. Then turn the child on their side and call your local emergency medical service, 911. Depending on your insurance, another type of emergency medicine is available. It's called Gvoke, and it's only to be used in children 2 years of age or older. You give it in the subcutaneous fat tissue, just like insulin, so it could be the arm, the belly, or the thigh. Now, Nurse Wendy will show you how to use it. Pull the red cap off. Push the yellow end down on the skin and hold and count to 5 for 5 seconds. The window will turn red and then remove the needle from the skin. Turn the child on their side and call 911. Another form of glucagon available is called Baqsimi, and it goes into your child's nose. It's very easy to use. Let's watch Nurse Wendy demonstrate how to use it. Remove the Baqsimi from the case. Hold the device between your fingers and thumb. Do not push the plunger yet. Insert the tip gently into one nostril until fingers touch the outside of the nose. Push the plunger firmly all the way in and you will hear 2 clicks. The dose is complete when the green line disappears. Turn your child on their side and call 911. When an unconscious child wakes up, they may vomit. To prevent choking when vomiting, turn your child on their side. This is known as the recovery position. When your child is fully awake, have them drink some juice. If your child doesn't wake up after 15 minutes and emergency personnel are not there, it is okay to give the glucagon one more time. Always call your doctor if you have needed to use the glucagon, and remember to call your pharmacy and refill it as soon as possible. Glucagon is a hormone that is sensitive to heat and cold, so don't leave it in your car in the summer or winter months. Also, do not prepare it ahead of time.
Make yourself familiar with the use of glucagon before an emergency, and make sure that all caregivers are trained on the type of glucagon for your child, as they may be the ones who need to use it. If your child has a low blood sugar but is responsive and able to swallow, give juice or 4 glucose tabs to increase the blood sugar. You may need to repeat that treatment until the blood sugar is back in range. For severe low blood sugars, it is important to call the clinic after glucagon is given. We will need to closely monitor your child and likely need to make insulin dose adjustments. Some good rules to follow include: never wait to treat a low blood sugar, always treat right away. Be sure people who are with you frequently know about your diabetes and know how to treat a severe low blood sugar. When someone suggests that you need to take something for low blood sugar, test and treat if appropriate. Be alert to new symptoms, as your symptoms may change over time. After having a low blood sugar, stop, think, remember how you felt, and identify new symptoms that may warn you of low blood sugars in the future. Be especially alert for possible low blood sugars during sleep. Test blood before bed and follow your snack schedule. After meals, if less food was eaten than covered by your insulin dose. And after increased activity. Remember that exercise can continue to lower blood sugar for several hours. Please continue with the next video in the series, as we'll be discussing hyperglycemia or high blood sugars.